I'm currently in my 4th year of medicine. The course has definitely in years 1 and 2 to a much larger extent allowed me to learn a vast body of knowledge. There's quite a lot to be covered in the first 2 years, and obviously certain things better than others, but it is definitely one of the main things that I think in the first and second years were very important and very sort of crucial, in that there was just so much to learn. Going into your 3rd year and clinical years, you learn how to apply the knowledge you learn in the first and second years to a clinical setting. So, now it's not about, this is the heart, this is the anatomy. It's about, this is a patient, Mr. X, Mrs. X, and they need your help. What are you going to do? And you need to be able to apply what you've learned in the first and second years, as well as some new information that you're given, and be able to help them in a clinical setting. As you begin your 3rd year, you don't have much experience in taking a history, doing examinations, and obviously as you go along, you gain more, you have more opportunities to do these things, and you're able to learn a lot more, and you're able to reflect on how you've changed from the beginning till that year. And one thing that I've definitely noticed is we have structured examinations at the end of the year called OSCEs, which are practical examinations. You do them more and more often as you go into clinics, and you realise how you've changed and how you've learnt from these, and you're able to sort of reflect. My first placement last year in my 3rd year was cardiology, and going into a place when obviously at the beginning it's very scary, it's a new environment, you're used to lectures, and you're not really too sure about what to expect, but definitely going into the clinical side of medicine has helped me improve my communication skills massively. And I guess there's nothing like actual experience in talking to patients to improve those skills, because you can talk about them all you want in a sort of a lecture type or a tutorial type setting, but it's nothing like actually going out there and speaking to patients and actually using the skills that you've learnt. The other thing is using the knowledge that I've gained both in the preclinical and clinical years to make evidence-based decisions that are relevant to the patient, that are in their best interest, and that actually help to improve their outcome and not just sort of alleviate symptoms. But obviously, if it's not possible, you have to do what you can. Because we do go onto clinics in groups, and you're sort of separated from your friends, and you might be with completely new people that you might not have met before, and it sort of teaches you how to work well, both as a team as well as being an individual sort of person for yourself, and going out there talking to people. And I think especially at the beginning of 3rd year, you're sort of all very scared, and you go in groups, and you don't want to talk to anybody on your own, and then as you go along, you learn more to be independent, to do things for yourself, to talk to people on your own, and you sort of build up the confidence that you need